As the planet warms, something ancient stirs beneath the ice. Mosquitoes migrate. Cities swell. And diseases we thought we'd left behind begin to reappear. This isn't science fiction. It's the future unfolding. And today we're asking, are we ready for what's coming? Climate change isn't just about rising seas or extreme weather. It's reshaping the map of disease. Warmer temperatures expand the range of mosquitoes and ticks, bringing malaria, dengue, and Lyme disease to places they've never been. Deforestation and habitat loss push wild animals closer to human populations, increasing the risk of zoonotic spillover when diseases jump from animals to humans. Think Ebola, Nipah, even coronaviruses. As ecosystems destabilize, so does the delicate balance between species, and we're part of that equation. But what if the next threat isn't new, but ancient? In a lab in France, Dr. Jean-Michel Claverie held a vial of ancient permafrost. Inside, a virus that hadn't stirred in 30,000 years. It didn't infect humans, but it did infect amoebas. And it was still alive. He called it a warning from the past. A signal that what's buried may not stay buried. In Siberia, a heat wave thawed frozen soil and released anthrax spores, infecting reindeer and people. Simulations show that even a small percentage of these microbes could disrupt ecosystems, or worse. As glaciers melt and permafrost thaws, we're unlocking biological time capsules. And we don't fully understand what's inside. So how do we prepare for threats we can't see? AI is now scouting for the next pandemic. On December 30th, 2019, an AI platform called Blue Dot flagged a cluster of pneumonia cases in Wuhan. It didn't know it was COVID-19, but it knew something was wrong. The alert went out before the world was watching. That algorithm didn't save the world, but it proved we could see the next one coming. Today, AI scans global data streams, predicts outbreak hotspots, and helps design vaccines faster than ever. Genomics is the backbone of this surveillance. In South Africa, a team of scientists sequenced a new variant of COVID-19 in record time. They shared it with the world instantly. That act of transparency helped update vaccines and guide travel policy. It also sparked backlash. Travel bans. Blame. But the science held. And the world learned, sharing saves lives. The WHO's new global network connects over 200 organizations to monitor pathogens and prepare for what's next. Together, AI and genomics form a digital immune system, one that learns, adapts, and evolves. When climate change displaces people, it doesn't just move bodies, it reshapes entire health landscapes. Rising seas, droughts, and extreme weather are forcing millions to migrate. These climate refugees often end up in overcrowded cities, informal settlements, or camps with limited sanitation and health care. Fatima, a nurse in a Sudanese refugee camp, sees outbreaks before the headlines do. Cholera, malaria, respiratory infections. She has no AI dashboard, no genomic lab. Just a thermometer, a notebook, and a line of patients that never ends. Her story reminds us, surveillance must reach the margins, or it's not surveillance at all. Urbanization itself isn't the enemy, but rapid, unplanned growth is. Dense populations, poor infrastructure, and limited access to clean water create ideal conditions for outbreaks. Diseases like cholera, tuberculosis, and respiratory infections thrive in these environments. And when a new pathogen emerges, it can spread fast. This isn't just a humanitarian issue, it's a global health imperative. Preparedness must mean protection for everyone, not just those with stable addresses. The COVID-19 pandemic exposed painful truths. Countries working in silos delayed the global response. Vaccine access was unequal. Misinformation spread faster than the virus itself. But lessons have been learned. Global surveillance networks are expanding. The WHO's International Pathogen Surveillance Network now connects labs and health systems across continents. Regional cooperation is strengthening. Health equity is now central to preparedness. In California, a grassroots network called Stop COVID-19 CA trained local leaders to fight misinformation. They didn't just translate science, they rebuilt trust. In barbershops, churches, and WhatsApp groups, they turned confusion into clarity. Because the truth doesn't spread on its own. People carry it. The next outbreak won't wait for us to get it right. The next pandemic may already be out there. But next time we might see it coming. Climate change is accelerating. Diseases are evolving. And our best defense is to stay informed, stay connected, and stay ahead. Support science. Demand equity. Share this story. Because the future of health belongs to all of us. This is Tomorrow Today. Subscribe for more futures.